Now we'll discuss one MCQ. A 28-year-old athlete begins high intensity dynamic exercise. Within the first 10 to 20 seconds, skeletal muscle blood flow shows a transient decrease followed by a rapid increase. Which of the following combinations best explains the sequence of vascular events and mechanisms involved? So let us discuss exercise physiology. What are the different effects of exercise physiology on cardiovascular system? Cardiovascular changes during exercise. So the skeletal muscle blood flow increases. During exercise, the skeletal muscles work more. That's why blood flow increases towards the skeletal muscle. The skeletal muscles blood flow increases by various factors like local factors or local metabolites. Second, neural factors. Third, humoral factors. So let us discuss one by one what are the different local factors, humoral factors and neural factors responsible for increased blood flow towards the skeletal muscle. First, local factors. So as the skeletal muscles works, the basal metabolic rate or the metabolism increases. So as the metabolism increases, it causes increased production of local metabolites like H plus ions, like carbon dioxide, like lactic acid, like potassium. All these factors acts as a local metabolites as local vasodilator system. So all these things acts as vasodilation, so that the blood vessels dilated, so blood flow increases. This is one mechanism. Second, neural factors. The skeletal muscles are supplied by sympathetic, noradrenergic and sympathetic cholinergic. The sympathetic noradrenergic fibers mainly supplies to the veins. Okay, so whenever the sympathetic noradrenergic fibers are activated, that causes vasoconstriction. Okay, whenever sympathetic cholinergic fibers are activated, that causes vasodilation, particularly in the arteries. Okay, so what will the effect? The effect is the sympathetic adrenergic fibers that supplies the veins causes vasoconstriction. So whenever there is a venous constriction will be there, increased venous return will be seen. So increased cardiac output will be seen. Increased cardiac output. So this is one effect. If the cardiac output is increased, then increased blood flow to skeletal muscles. Okay. The second thing is that sympathetic cholinergic fibers. So whenever they are activated, that causes arterial vasodilation. So increased blood flow. Okay. The other factors that are responsible are humoral factors. In humoral factors, increased sympathetic stimulation causes release of adrenaline from adrenal medulla. So increased adrenaline secretion occurs. That adrenaline acts on particularly beta 2 receptors of skeletal muscles. Okay. So that beta 2 mediated vasodilation occurs. Beta 2 mediated vasodilation occurs. If beta 2 mediated vasodilation occurs, that causes increased blood flow. So there are local metabolites, which is the chief mechanism for increased blood flow to the skeletal muscles. There are humoral factors, there are neural factors responsible for increased blood flow. One point to remember to note down here: while doing exercise or initiating the exercise, the muscle or the skeletal muscles contracts for a brief period, for a short period. The skeletal muscle contracts. Okay. So what will happen? Decreased blood flow because of the skeletal muscle contracts the blood vessels so rapidly or so vigorously that blood flow literally decreased. But here, if the blood contracts, then the venous output increases. And after that, when the muscle acts, the metabolism increases, and whatever the different mechanisms that acts on through local metabolites, vasodilator mechanism will acts. Okay. So whenever we will calculate the venous output during contraction, it increases, and during whenever the muscle relaxes, the blood flow increases. Coming back to the question, initial fall due to alpha 1 mediated vasoconstriction, after that subsequent rise due to adrenal catecholamine acting on beta 2 receptors only. The initial fall is not due to alpha 1 mediated vasoconstriction, it is due to compression of the muscles, and also the subsequent rise due to adrenal catecholamine acting on beta 2 receptors only. No, it is not only beta 2 receptors mediated via adrenaline, it is not like that. The local metabolite is the chief stimulation for the vasodilator mechanism of increased blood flow. So this option is not correct. Regarding option B, initial fall due to mechanical compression of intramuscular vessels, right? Subsequent rise due to local metabolic vasodilation overriding sympathetic vasoconstriction. Yes, here we have to note it down that the compression initially is due to mechanical intramuscular vessels, and the subsequent rise is due to local metabolites. I have already told that the local metabolites are the chief mechanism for vasodilation of the skeletal muscles. Overriding the sympathetic vasoconstriction, the sympathetic noradrenergic fibers that causes vasoconstriction, it will be overridden by the local metabolites action. The initial fall due to decreased venous return, no. The initial fall due to mechanical compression. Subsequent rise due to sympathetic cholinergic vasoconstriction, no. Subsequent rise due to local metabolites. Option D, initial fall due to reduced cardiac output, no. Initial fall due to only mechanical compression. Subsequent rise due to increased capillary permeability, no. Subsequent rise due to increased local metabolites and sympathetic cholinergic activity, that is through beta 2 receptor and also humoral factors and neural factors. In initial fall due to parasympathetic withdrawal, no. Subsequent rise due to increased blood viscosity, no. So here the correct answer is option B.